Hello and good afternoon, or good morning, or good evening, depending on where you are joining us from. And thank you very much for joining us for this press briefing of the Africa Centers for Disease Control and Prevention. My name is Wayne Musabayana. I'm Head of Communication at the African Union Commission. Let me start by just saying how glad we are to be back with you after a 2-week break. And that was occasioned by a number of issues. The first one was a very important board meeting of the Africa CDC that was determining the way forward for this very important agency of the African Union. Then Dr. John had to go on a short break. And then also today, Dr. John was engaged with the Permanent Representatives Committee, which is the grouping of ambassadors of the member states of the African Union. They are one of the most important structures of the African Union. And so they called him to go and attend a meeting and explain some issues to them, and hence the delay today. So our sincere apologies for those breaks, but we are really happy that you are with us and hoping that we will be able to continue on a weekly basis as before. So, as usual, we will start with a briefing from the director of the Africa CDC, who is Dr. John Nkengasong, and he's already on standby for that. After his briefing, we will then go into our question and answer section, and the WhatsApp number that you can use is +251 94 550 2310. That's +251 94 550 2310. Alternatively, you can come through live or write down your questions on the question and answer section, and we'll pick them up and give them to Dr. John. All right, so thank you very much. Let me now hand you over to the Africa CDC Director, Dr. John Nkengasong. It's over to you.
Thank you, Wayne, and colleagues. It's a pleasure to be back after 2 weeks of a break. As Wayne explained, as you all know, during the summit, that is the AU summit in February, the head of states decided to elevate the status of Africa CDC, and the governing board was discussing ways forward on how do we carry that forward about 2 weeks ago. And I'd had to take a break the week after. So we are back, and we'll continue to maintain our schedule as before. So today I will do, as usual, 3 things. I will look at the review for you, the epidemiological situation of COVID on the continent, then discuss the vaccination issues and the progress. And then I would like to also conclude by just bringing you up to date on the vaccine manufacturing in Africa. So first of all, let's start with the epidemiology situation. As of today, April 14, the continent is reporting a total of 11.3 million cases of COVID across the continent. Of that number, about 251,000 people have died, unfortunately. If you look at the dynamics there across the continent, and we'll go to that. But before we touch on that, let me first of all comment on the variants. As we speak, 48 countries out of the 55 member states are reported the Omicron variant. And 16 member states are now reporting the BA2 sublineage of the Omicron variant. That includes Algeria, Botswana, DR Congo, Ethiopia, Kenya, Malawi, Mauritius, Mozambique, Namibia, Nigeria, Rwanda, Senegal, South Africa, South Sudan, Tunisia, and Zambia. We know that the pandemic is now dominated by this lineage of the Omicron variant. So let's discuss and review the trends over the last week and then 4 weeks. Between last week and this week, we, as a continent, have reported about 20,000 new cases. So we continue to see a decrease of the 7 days moving average across the continent. If we now look at the number of deaths on the continent of 1.3 billion people, we were reported a total of 319 deaths. That represents a 14% decrease over the last week. If we now look at the 4 weeks, that is the period between 11th of March and 10th of April, we, as a continent, recorded a decrease of new cases in the range of 16% average decrease. And in terms of deaths during that same period, there was an overall 2% average decrease in number of deaths during that same period. The testing has decreased on the continent, and I'll add, unfortunately so, and we should not be less vigilant, which cannot be complacent. Testing is the cornerstone for us to continue to fight this pandemic. So I urge all member states to increase rather than decrease the testing. When you are at a low transmission season, that is why you really test a lot, so that you pick the spots, the hot spots, and you deal with it effectively there. So again, my appeal is that we do not relent on testing across the continent. In order to, now onto vaccines. We know that, and we'll discuss this shortly, that as a continent, we've received about 770 million doses of vaccines across 54 member states. And of that number, 514 million COVID-19 vaccine doses have been administered, which represents 66.7% of the total supply. The coverage, that is the number of people fully vaccinated, stands at 16.2% fully vaccinated. 10 member states have vaccinated in excess of 35%, and they include Seychelles with 81%, Mauritius 76%, Rwanda 63%, Morocco 63%, Cape Verde 55%, Botswana 54%, Tunisia 53%, Mozambique 43%, Sao Tome and Principe 40%, and Lesotho 36%. Now, in order to continue to improve vaccine uptake and following the recommendation of our COVID champion, President Cyril Ramaphosa, in February during the summit, he specifically asked us to be innovative. And one of those innovations is that we launched the Bingwa initiative on April 7, which is just last week. And the Bingwa is really a program that targets young Africans, recognizing that 65% of the population of the continent is less than 25 years old. And if we have to get to 70%, we must make these youngsters to be part of the program. They must be champions. So Bingwa essentially in Swahili means champion. So it was a very successful program that was launched in collaboration with UNICEF, WHO Regional Director for Africa, Dr. Chidi Moeti was present. The MasterCard Foundation, which is one of our major partners, was present. The German corporation was also present. We really hope that in the coming days and weeks, these youths or youngsters will continue to be important actors in the fight against COVID-19 on the continent, specifically encouraging young people and their communities to uptake vaccines. We'll keep you informed and updated as we make progress. The Harvard mechanism, which is one of the prides of Africa, had now delivered about 45.5 million doses of the Johnson & Johnson vaccine. The Johnson & Johnson vaccines, as we all know, are the single-dose vaccines. So if you translate that into the double-dose vaccines, it would actually be equivalent of close to in excess of 90 million vaccines delivered in 35 countries. But we ask that all member states that have placed their orders through the Afro-Exim Bank should go ahead and collect their deliveries, because those vaccines are available. About 34 million are in storage, and they're waiting for countries to accept those, to declare their intention to get those vaccines delivered. Let me just conclude my briefing, as I indicated earlier, by highlighting the situation of vaccine production on the continent. You all recall that on April 12 and 13 of 2021, we launched the Partnership of Vaccine Manufacturing, abbreviated PAVM. And that became a framework for vaccine manufacturing in Africa to get to the target that the continent agreed on, that within the next 20 years, at least 60% of vaccines should be produced on the continent of Africa to guarantee Africa's health sovereignty, of course, including other components like diagnostics, personal protective equipment, and therapeutics. We are very pleased that so many countries are now engaged. I just came out from the briefing with the permanent representatives of the ambassadors, and Algeria actually has 2 manufacturing plants going on. Their target is to get to 60 million doses at the end of the year manufacturing. They are actually supporting other countries like Mali, Tunisia, and I believe Niger, they mentioned, with vaccines that they produce themselves. Egypt, Morocco, Senegal, Ghana, Kenya, Rwanda, of course, South Africa have all engaged in the journey to produce vaccines on the continent, which is very, very much welcome. If we look back from where we are coming, from 1% vaccine manufacturing to where we are with this number of countries manufacturing, it is extremely pleasing that truly the new public health order that we are calling for, which resides on 4 pillars: manufacturing of health security commodities, strengthening institutions, including the African Medicine Agency, AMA, beefing up the workforce on the continent, and working with the private sector and partners in a respectable, action-oriented manner, are all taking off, and moving forward. In the coming days, we are going to have a summit on the new public health order. But let me pause here and say that despite this progress, I am deeply concerned that of the situation that is happening as we speak in South Africa with Aspen. You know that the Aspen has been licensed since December to produce the Johnson & Johnson vaccines, and so far they have received no orders. And the risk is very, very high that that company may actually stop producing the Johnson & Johnson vaccines. So I think this is an appeal to the international community and to the entire continent that we must rally our efforts and support that vaccine producing company in Africa, which is already doing the job. There's no point talking about vaccine, the need for global health security, to invest in regional capacity to produce diagnostics, vaccines, and therapeutics if countries and pharmaceutical companies begin to produce those and they are not purchased. I think that the argument that Africa is not taking up enough vaccines, I don't think is valid. We have seen how when other parts of the world were challenged with uptake of vaccines, how other incentives, packages of incentives were put together to support the uptake of vaccines. I think we should do everything possible to maintain our public health hat on, to continue to mobilize the population to uptake the vaccine, but very importantly, to be very deliberate that we want to support African manufacturing. Regional manufacturing of vaccines is an indisputable pathway to guaranteeing our collective health security or global health security. There's no way we can circumvent that. We've lived through this crisis for 2 years. We've seen how disruptive it can be in our own trusting relationship with the South and the North when vaccines are available only in some parts of the world. So it has to be a very deliberate effort to supporting the shaping the market so that vaccines produced in Africa must be purchased adequately so that we maintain the vaccine manufacturing capacity. Vaccines are not like drugs. where you can just produce and put them on the shelves. Vaccines have always traditionally been purchased by aggregating those orders and then pre-financing it, like structures like Gavi, the COVAX, the ACT Accelerator must be ready to support the continent to buy these vaccines so that we do not run into a scenario, a very uncomfortable scenario where it will undermine completely all our collective efforts to strengthen our collective health security. I just wanted to make that point because it's so pertinent at this point. So thank you, Wayne, and over to you. I look forward to answering any further questions.
Thank you very much, John. Indeed, that's a very, very important point that you mentioned at the end there. Now, before we go into our question and answer section, let me just remind colleagues of the WhatsApp number that you can use, and it is +251 94 5502 310. 251 94 5502 310. We can also take your questions live as well as through the question and answer platform. Now, John, the very first question that we have is very much related to the last point that you raised, and it is coming from Kerry Cullinan, who is with Health Policy Watch. Kerry says, yesterday, the IFPMA Director General said the Africa CDC was stopping and cancelling vaccine orders as many of the member states in Africa lack the capacity to roll out vaccinations. What is the status with the orders, and which countries are struggling to roll out their vaccination campaigns?
So let me first of all start by correcting that. The Africa CDC has not asked that there should be cancellation of any vaccine orders. I think I corrected this a long time ago when Politico wrote that article saying we asking for pause to vaccine. And I've since written in the New York Times to clarify this. What I said clearly is that we should coordinate our vaccine delivery efforts so that you don't supply the continent with vaccines all at the same time in the first quarter, and that run the risk of expiration. And we've seen that happening. Just 2 weeks ago, Kenya had to dispose about 800,000 doses of vaccines, and other countries are doing similarly there. That is the warning that I gave, that it must be coordinated. And we have to be sure that the narrative is right, that it is not because some parts of the world have not finished vaccinating and they have excess that they donate in Africa, that Africa will be ready to use all those vaccines at the same time. It must be coordinated. It must be done as a program. And we are not just discussing this and arguing for this. We have convened a series of meetings, including just last month, a meeting with ministers of health, as well as partners, to say, hey, we must coordinate our efforts. This is an appeal, a call to action by President Ramaphosa, who is the COVID champion, and when he made his report in front of all head of states in February, calling for stronger coordination of our efforts so that we can continue to vaccinate appropriately there. Delivery is important. I really like to see the same efforts that we've put in ensuring that vaccines are now available. We turn that efforts as well into the delivery. Delivery of vaccines from the airports to the arms is key. Countries need transport mechanism, storage facilities, because if you send any country in Africa millions of doses of vaccines, you need storage. Where is that storage there? We have to build efforts there and support them to do that. We need a surge capacity of workforce, okay, to do that. Countries needs to be supported there. We need to move the vaccines to the last mile. We need accessories, okay, needles, syringes, and others that will be required. So that is what we're saying. So again, just to say that no one at Africa CDC, and not me, have said that we should cancel the vaccination. I've argued for and called for a coordinated approach so that vaccines do not arrive all at the same time. Even if you're a developed country and vaccines suddenly show up on their borders in abundance, you run the risk of not using those vaccines appropriately. I just wanted that point to be absolutely clear.
All right, thank you, John. Colleagues, I think Dr. John there is really making a plea for us to communicate on this issue, that the Africa CDC is not asking for cancellation of the delivery of vaccines, to the African continent, but more for a coordinated approach. So thank you very much. Let's move on to the next question, which is coming from Lawrence Caramel. And Lawrence is with Le Monde. He says, do you consider it as still realistic to maintain the 60% goal for vaccination? And if so, when do you think it will be achieved?
Very good question from a colleague from Le Monde. I think we should continue to strive to get to 70% of the, as WHO have stated. Not even remember early on in this pandemic, the Africa's Union had endorsed a 60% position. At that point, the narrative was that 20% would be enough. I think we use facts and science to determine 60%. WHO has since come forward and say 70%, and others have said the same thing. We should strive to get to that point. We should not be deceived that because we are in a low transmission season in Africa and across the world, that we will not see the pandemic rebound. We've seen this scenario over and over. I was just analyzing our own data, and when I briefed just a few minutes ago the Permanent Representative Council of Ambassadors at the African Union, and I showed them very consistently that when the low transmission season usually lasts between 2 months and 3 months, and we've seen this 4 times, okay, where we go down into the low transmission season and then it comes back up. So it doesn't mean the virus is gone. How are we going to rebound? I don't know, because there's a lot of exposure now in the community, coupled with the vaccination rate of 16%. Maybe it will offer some protection in the community, what we call a population immunity. I don't know. But the short answer to your question is yes. Let's put that as a programmatic goal and continue to support countries to get to that level so that the shared optimism that we are seeing across the world should be enjoyed across the world completely and not just some parts of the world.
Thank you, John. Judith Akolo is writing from the Kenya Broadcasting Corporation in Nairobi. My question is, what will it take to get the member states to begin to look at vaccination as part of prevention of diseases, as opposed to curative countries seem to love to invest in?
So I think that is, Judith, a very good public health question. I think in my 30 years and above in public health, we all know that there is usually, unfortunately so, the most impactful interventions are your preventions, and vaccines are the most effective interventions that you have in public health. However, because vaccines prevent, you don't see the glory, because when you prevent something, you don't see it. You don't see it happening. So if I take my COVID vaccines and I'm not infected, I truly don't appreciate what would have happened had I not been vaccinated. So that is what I mean by there's usually in public health no glory in prevention, which is very, very unfortunate. People tend to gravitate towards treatment because if you are sick, you have a fever, a cough, you take your treatment, you immediately, after 2 days, you start recovery. And you actually acknowledge that more than the prevention there, which is unfortunate. The most impactful interventions in over the history of infectious diseases are vaccines intervention, be it in polio, measles, meningitis, etc. We see that vaccine. So again, the continent should see scale up of vaccination as a necessary pathway to guaranteeing the health security of the continent. And we will continue to champion this cause.
All right. Thank you very much. Janice Q from Bloomberg. Do you have statistics on the BA4 and BA5 variants, and how widespread are they on the continent?
Yes, we do have some statistics. Let me just read what I have here for. We have for the Omicron, B11529, for the 8 member states have reported that variant. Then if we look at the lineage, the Omicron BA2 sublineage, about 16 countries have reported that variant, that lineage. And they include, as I said earlier, Algeria, Botswana, DR Congo, Ethiopia, Kenya, Malawi, Mauritius, Mozambique, Namibia, Nigeria, Rwanda, Senegal, South Africa, South Sudan, Tunisia, and Zambia. There could be more out there, but these are the countries that have officially notified us of the availability of this lineage, that is the BA2 sublineage.
All right, thank you. Let's say hello to Paul Adepoju, who's joining us online. Paul, good afternoon or good morning.
Yes, good morning, and thanks for taking my questions. Dr. John, you mentioned the reduction in COVID testing in Africa, but I would like to know if you can provide some data to give us this trend, how the reduction is going, then which countries are we seeing the sharpest drop? Then regarding Africa CDC itself, I would like to know the status of the regional center in Egypt. Do we have an idea of when it's taking off? And concerning the development regarding Aspen, how do you see this trend? Is it being impacted by the availability of doses that have been donated, that countries are seeing these doses for free? Or how is this trend different from the initial plan that the facility had, especially with the South African government, considering this was a South Africa government fully supported initiative? Thank you.
So in terms of testing, Paul, overall, cumulatively, the continent has conducted about 104 million tests. Again, those are official reports. In terms of new tests, just this week, 582,000 new tests were conducted. If you compare that with the last week, that represents a reduction of 9% decrease. Because last week was that is the week before the continent had conducted 637,000 tests. That again, all of these are reported numbers. The cumulative positivity rate is around 11%. That is of people that are tested, which represents a test per case ratio of 9.2. Okay, which is still high. So I don't know. I don't have the information country by country. But in this briefing, but I'm sure that our Emergency Operations Center folks will have that information. Egypt, the center in Egypt has not yet been operationalized, and because of the still waiting for they call it the hosting agreement to be signed, and I think we remain hopeful that hosting agreement will at some point be signed. Now, the last 2 years have been very problematic for all of us because the focus has been on our ability to respond to this a terrible pandemic. So we hope that this year we can make progress or go back to the drawing board and see what is hindering the takeoff of that and then address it accordingly. So your last point on the donator really impacting the equation. So again, and your point, Paul, I'd like to expand on that a little bit. Now, if you recall the trend, now memory is very short, and then we tend to begin to not put the situation in the right context. When the COVID vaccines were delivered, the first COVAX vaccines were delivered on the continent around March of last year. The continent was really ready for that. I was at the airport receiving vaccines. People were ready to jumping up and ready to get vaccines. But then there was a shortage of vaccines. Okay, not really shortage. There was complete stoppage of delivery, if you remember, because shortly after that, India imposed a ban on that. And it became a very big concern for the continent. That's why the continent accelerated the AVAT mechanism to acquire its own vaccines. A continent of 1.2 billion people could not have just been waiting for the COVAX mechanism to deliver them vaccines. So that initiative, AVAT, which is a historic intervention, strong leadership from President Cyril Ramaphosa and others, Chairperson Moussa Faki, must always be remembered because it came at a point of need. The Afro-Exim Bank allocated $2 billion to supporting that. I like history to always remember that it was very important. And if vaccines had been available in a consistent manner at that time, I'm sure that we wouldn't have gotten into the situation we are today. So fast forward, the Africans set up that facility, and the 400 million doses of vaccine was secured and guaranteed by African treasuries. Okay, that we all know. I mean, I'm recalling all what you know, but I'm heading to a point where now that vaccination coverage increased tremendously in developed countries, that they started donating, doing a lot of bilateral donations there. And that, of course, countries started receiving those, and now we're not following through with their own avert supplies. But it's a commitment, it's a legal commitment that they made with, to get those vaccines when they were in need. So you just cannot walk away from those things there. But having said that, it is very clear that this pandemic is not over. So we should not be discussing vaccine needs as if the pandemic is over. We truly don't know how many times we need to boost. I mean, I've received my vaccines and boosted, and I don't know if maybe in the next 6 months or 4 months, I should go in for the 4th dose. The Johnson & Johnson vaccine continues to be one of the best vaccines in terms of protection over time. So it's a strong appeal to all member states to not to continue to respect their engagements that they had through AVAT to get their vaccines. That shows self-determination, and it shows that, I mean, a leadership. It shows ownership of our own health security as a continent. I think we must be very proud of that moment, but follow through and make sure that vaccines that were ordered are delivered, and even take it further and make sure that we convince the population and continue to engage the communities to take up these vaccines.
Thank you very much, John. Let's say hello to Lucia Blanco. And Lucia is with the International Spanish News Agency. Why do you think that Aspen is not getting orders for the J&J vaccines? And who should be ordering those vaccines? Is it governments or international mechanisms like COVAX? And lastly, is the price of those vaccines competitive now? And she says, thanks a lot.
Yeah, I think it's not it's not thinking. It's a discussion that I'm having with the leadership of Aspen. And I'm not the only one they are talking to. They have been very transparent with that they're receiving no orders. And they are very clear that they don't want to surprise anyone, that in the next coming months, if they don't receive any further orders, they will need to shut down that facility. So we cannot and must not allow that to happen. And the orders, as you rightly stated, should come from our international community efforts. We need expression of solidarity and international cooperation, which we've all appealed to during this crisis. We also need that African countries continue to not only wait for donations, but also commit themselves in buying these vaccines, because, again, it's not enough to just get 2 doses. This is a tricky virus. We don't know what the trajectory of this virus holds for us, but making commitments, collective commitments through AVAT, so that that factory can continue to produce the much needed Johnson & Johnson vaccines is critical. I think that, vaccines, as I said, are not like drugs where you can produce them and put on the shelves. There must be a collective mechanism. And this brings me to the international community. COVAX, Gavi, the ACT Accelerator must all mobilize and support that companies so that they can sustain their production facilities. Otherwise, why have we been all along calling for regional manufacturing? There's a global consensus that in order to ensure global health security, there must be regional manufacturing. Here we are with a company that is producing an amazing vaccine that the continent is using, is a backbone of the vaccination in Africa. Many countries in Africa actually are preferring the Johnson & Johnson vaccine, but is running a risk of shutting down that production. We cannot and must not allow that to happen.
All right, thank you. Judith Akolo comes back with another question. And she says, while you were talking to the PRC today, did you also impress upon them to inform the political leaders in the member states to stop getting excited about the low infection rates and to make statements that in effect tend to stop some of the measures that were used to contain the spread of COVID-19. And she says that these kinds of messages are really quite wrong, and they tend to impress upon the people that COVID-19 is behind us.
Judith, one would probably have thought that you were in the briefing today, because the briefing with the ambassadors today, because that was the centrality of the conversation. The centrality was about the pandemic is not over. This is only a low transmission season. Use this period to intensify. I was very clear that we should use this period to do 4 things: increase vaccine uptake, testing, surveillance, and of course, engaging our communities with the right messaging. Those are the things you do during a low transmission season as much as possible. We also discussed extensively the need to have a common position and voice to protect the vaccine manufacturing industry in Africa, which is just emerging. I mean, otherwise, before you emerge, you die if there's no collectivity around it and support for these countries that are producing vaccines. So I mean, one would probably think that you were in the conversations today. It was a very thorough and thoughtful conversation that I had with all the ambassadors.
Thank you, John. Edith Mutetia, who is with China Daily. What's your take on China's zero COVID-19 strategy? Would you recommend such a strategy for Africa, or should we as a continent learn to live with COVID-19?
I think we should learn to do the things that I've insisted we should do: increase vaccination rates, conduct surveillance as much as possible, increase our testing, and of course, maintain public health measures. That is, of course, washing of hands, masking when you are in a crowded space as much as possible. That's what I think we must be doing on the continent. And public health practice is common across the practice is common. I mean, and those principles are principles that should be valid across the board. I think I've been very clear on this, that the days of massive, at least for Africa, the days of massive lockdown is over. Vaccination rates vaccines available. We should go out and get vaccinated. And we should also be testing as much as possible, especially decentralizing testing to community testing and self-testing is what I have. I have my test kits here, and each day that I feel like I'm not feeling well, I test myself and whatever. And those rapid antigen test kits are available. That's what I recommend for the continent.
Thank you very much. Agostinho Leite is a journalist at Lusa, the Portuguese news agency, and he has quite a number of questions. So he says he'd like to ask you to explain the current situation regarding COVID-19 treatment protocols in Africa. Where do we stand? That's the first one. Then he says, what is being done so that African laboratories can also produce the new drugs under development? That's the second one. He goes on to say, should the pandemic mitigation strategy in Africa focus primarily on treatment at a stage when variants of the disease are becoming less and less lethal? So those are the points from Agostinho.
No, absolutely. The treatment, as you know, on the continent is still the access to those drugs, the two important drugs, molnupiravir and Paxlovid, is still very limited on the continent. I think we are working very hard with the two companies, as I told you earlier, that we're working with Pfizer and Merck to finalize the MOUs, the Memorandum of Understanding. Again, it's out of our hands. These things that they are negotiated at the level of the legal offices in both parties, but I've seen progress over the last couple of weeks. Again, it doesn't stop member states to have bilateral discussions. I think some of them are having a bit of the overall access to these drugs on the continent is very limited. We also have heard that one of the companies, I can't recall which one, was going to issue license to several countries to produce the generics, but I don't recall that there was any African country among those countries, but it's something that we continue to advocate. And very importantly, I also add to the list of things that I recommended that the way to continue to fight this pandemic going forward is the test and treat, in addition to vaccines and surveillance. So the testing is coupled to treatment. So the continent has to work very hard with partnership with the companies that are producing the drugs to have availability of the drugs. These drugs are so powerful and effective that they really they don't discriminate between variants, so they're effective across the variants. So having a test and treat strategy going forward, just as we've done for HIV/AIDS, will be extremely valuable. So to the extent that if these drugs were available and you have a new variant, the health systems will not be overwhelmed, because these drugs, you can administer them amongst healthcare workers, and it will knock up the virus regardless of the variant very quickly. So I think in some, the treatment protocols I believe WHO is issuing some guidelines. Access to the continent remains very, very limited. We are working on the access issues at the level of the African Union, and of course, in partnership with Pfizer and Merck.
All right, thank you, John. Lawrence Caramel has come back with a second question. Do some countries face lack of finance to roll out their vaccination plans?
Of course, you think yes, but I also believe that there's a collective support that countries can benefit and are benefiting from. You all know that we have the Saving Lives, Saving Livelihood initiative, which is a very strong partnership and bold partnership with the MasterCard Foundation. Countries are accessing that. I mean, the UNICEF and COVAX have some support. The World Bank is also supporting, and member states are putting their own resources towards vaccination. Is it enough? Can never be enough, because I outlined the challenges that are required: the transportation, the logistics, the vaccination, the storage, are all key areas that countries will continue to need support.
All right. Let's take a second question from Paul Adepoju.
Yes, thank you very much. Dr. John, on the wider lesson that the COVID pandemic has brought attention to, and something that you've continued to reiterate, which is this new public health order. From your personal perspective, talking to these ambassadors and by extension, leaderships from across the continent, are you seeing this active commitment, even when the attention they gave COVID at the initial stage is no longer there, to still be tending towards prioritization of prevention measures over response? And looking at the long term, are you concerned that the gains of prioritizing prevention over control measures is secure or is further threatened? Then a follow-up question to the Aspen development. We also see there are potentials of similar development happening to other potential COVID vaccine production facilities being set up in different parts of the continent. Would you recommend these facilities pivoting to manufacturing other vaccines that the continent has, considering the fact that countries would always be desiring to take free vaccines over something that they want to pay for? What is your position on these facilities pivoting to other vaccine needs that the continent actually needs?
No, I mean, Paul, very good question. I mean, one will also think that you were at the briefing of the ambassadors this morning, because I expanded a lot on the need for a new public health order, which is not a slogan. I mean, the new public health order says there are 4 things that we must do, and do it aggressively and collectively to secure the continent now to achieve its health security sovereignty. And I use the word sovereignty and bold and underline it. And they include the manufacturing of not just vaccines, but diagnostics and therapeutics. I think we have discussed therapeutics already. But let me comment on diagnostics. As we speak, on a continent of 1.3 billion people, Senegal is only now producing the antigen test. Morocco is only now meaning that during this pandemic, last year, they started producing the PCR test for COVID. And I think South Africa as well. We must remind ourselves that after 40 years of doing HIV testing, There's absolutely no country in Africa or laboratory that produce a simple rapid test for HIV. A simple rapid test for HIV, I repeat. So that is fundamental to the health security of the continent. A continent that conducts about 100 to 150 million HIV tests a year should be able to produce that, and a continent should be able to purchase made in Africa tests. And that way you transfer technology, you are self-sufficient, you guarantee. So that is part of the new public health order. It's not a slogan. Second is the workforce. I explained to the ambassadors this morning that according to the Global Health Security Index, the continent requires 6,000 epidemiologists. We only have 1,800. So here is a gap of about 4,000 that we need to fill. I'd like to see a program that accompanies what President Ramaphosa as a champion announced, I beg your pardon, during the summit, that we need to have an African health workforce task team. And those discussions started already 2 weeks ago. We started the first. So that's a gap that must be met, and that's part of the new public health order. What if we said today that by the end of next year or so, an additional 1,000 epidemiologists must be trained? And Africa CDC has engaged in this. We want to launch the African Epidemic Service Program, what we call the AES, which will be like the early responders to fight these pandemics on the continent. Thirdly, is strengthening the regional and national institutions, like the Nigeria CDC. You look at the tremendous work that Nigeria CDC did during this pandemic, the contribution that Africa CDC has done, and potentially when AMA is developed and finally functional, then if the combination of a network between AMA, there is the African Medicine Agency, the Africa CDC, and national institutions like the Nigeria CDC will give us the backbone as a continent to fight these diseases more effectively. And of course, fourth and very importantly is engaged in partnership with the private sector. You look at the work that we have done and achieved during this pandemic with the Afro-Exim Bank, with the African Development Bank, with Strive Masiwa, with Vera Songwe from the UN Economic Commission for Africa. Those are all, different partnerships that we must carry forward there. But also our traditional partners, we must embrace what we are calling an action-oriented, respectful partnership. Partnership that says that we are here to support the priorities of the continent and not to define it for the continent, because the continent knows where they are going to and they live with these challenges every day. They know exactly what they need, but they probably don't have what they need. So their partnership should align with these priorities. Those are the key elements of a new public health order. It's nothing magical. It's not a slogan for the future. It's something that is happening today. Where are we with that today? Leading to your second question. We launched to support the first pillar, which is the manufacturing. We launched the Partnership for African Vaccine Manufacturing. That has been a catalyst in moving these countries forward. You recall, Paul, that last year we had a summit where 40,000 people were on that platform. We had a subsequent meeting in Rwanda where President Kagame was there himself and other senior leaders of the continent to evaluate progress. Remarkable progress. I was in Marburg with the President Nana Akufo-Addo, President Macky Sall, and Kagame with the BioNTech facilities for the container manufacturing facilities that will be shipped soon to Africa. So that pillar is going on. You can hear me talk about diagnostics because we are incentivizing and encouraging all of that. Africa CDC, the second pillar, the head of states have taken a bold decision to make Africa CDC an autonomous health agency of the union, which is the African Union. That is again part of strengthening that, and we continue to urge the head of states, the Executive Council, and the Permanent Representative Committee at the AU that they should embrace the need for every country to have their own equivalents of the Nigeria CDCs. As we speak, about 16 countries have a functional national public health institute. We want to see more. We want to see the acceleration of the establishment of AMA. And I think, so those are some elements that are beginning to flesh out as part of the new public health order, which, if done right, will prepare the continent more appropriately to respond to the next crisis than it was before. So I think, again, we're very delighted with that, but we need all these partners. When I meet with all the partners and donors, that is what I say to them. And I ask that we all champion that new order for the continent.
Thank you, John. Agostino later has come back and he says he didn't quite get your answer to his question regarding, he was saying that should the pandemic mitigation strategy in Africa focus mainly on treatment at a stage when the variants of the disease are less and less lethal?
No, I mean, I think I explained what we must do as a continent from a public health perspective. I talked about continue to test. I talked about continue to do surveillance. I talked about the test and treat. I mean, that access to treatment. And of course, I talked about scaling up vaccines. All of those things must be done together. And it's not variant specific. We cannot take a variant specific approach. It must be a holistic approach. And those are the key elements that we are promoting at Africa CDC. Of course, masking is constant. Wherever you get into a crowded space, we should mask appropriately.
Thank you for going over that again. Perhaps he didn't quite catch it the first time. Our last question that we have here is from Lucia Blanco, and she's coming back. And Lucia is with the International Spanish News Agency. She says, I just want to go back to one of my questions. What is actually stopping governments and international mechanisms from ordering vaccines from Aspen? Is it a matter of lack of competitiveness of their prices?
Oh no! The prices of the Aspen are just as the same prices that have been there. I mean, they are not. I mean, I cannot give you exact figure, but I'll be happy to bring the figure to you next week's briefing. Just because I don't want to give you a quotation that is not accurate, but I'll find that information and give you. It's exactly the pricing that we are getting the vaccines through the Harvard facility. So. The world has to make a conscious decision to that. So what is preventing that? I think Paul touched on this. Countries are getting a lot of donated vaccines, so they don't see the urge to go order for vaccine. But that is a short term, that will be complete short-sightedness if we only rely on donor vaccines and not invest and promote our own facilities on the continent. That is, again, a recipe for preparing ourselves as a continent to be to be backward when the next time you are hit with another pandemic. I think that is very clear. The international community must exercise that cooperation and solidarity that we all know are underpinning of the COVAX, the ACT Accelerator, and mechanisms which we are all part of. I think President Cyril Ramaphosa is the co-chair of the ACT Accelerator. We are saying that it has to transcend what is happening, which is the countries or individuals not taking up vaccines, but put that in the context of health security. We are doing this because we want to be sure that that company that is producing a vaccine already is sustained and we can diversify. Again, one of the questions I think, Paul, you asked is, should countries be diversifying? Yes. I think the whole beauty of the mRNA platform is that you can use that in producing other types of vaccines while waiting for the pandemic. And I think the site in Senegal is building two parallel structures, one for the mRNA and one for other vaccines. I think I would strongly encourage all countries that are producing vaccines, and I know Morocco is doing the same, that you not only focus on COVID vaccines, but you focus on other vaccines, production of other vaccines, and if possible, other treatments, not just vaccines, so that you have silver pipelines that can maintain those facilities moving forward. If you look at a group like Johnson & Johnson, they produce medication, they produce vaccines, they produce diagnostics. Yes, Africa is only starting in that space of manufacturing. You need to start somewhere, but I say that if the focus is on vaccine, you expand the vaccine portfolio and not just produce COVID vaccines.
Thank you very much, John. It is now time for you to give us your summary, a roundup of the main points that colleagues should be taking away from the briefing today. So
two things I really want to leave you all with, that it is for the collective global health security interest that the continent of Africa is supported so that we all get the continent to increase its vaccination. That is more vaccines, but also more delivery, support for more delivery of the vaccines. So that is message number one. Number two is support vaccine manufacturing, and very specifically, let's rally around the Aspen manufacturing because they are already producing those vaccines, and it will be unfortunate, and history will not remember us well if we let that company go on that and stop producing the vaccines in the middle of a pandemic. I don't even know how we are going to write that in the history books to come. And I think that is my last message is that we cannot be complacent, that we are at the low transmission season. We need to do at least get ourselves prepared for the days that the pandemic will come back up. I think we need to expand testing, need surveillance, and need to prepare for the test and treat strategy, and of course, uptake of vaccines. So those are my key messages that I will leave at this point, observing the data and looking at the distribution of the pandemic over the last 1 month and 4 weeks. Those are the measures that I believe will be preparing the continent for any eventual surge or ticking up of the infections.
Thank you very much, John. That was Dr. John Kengasong, the director of the Africa Centers for Disease Control and Prevention. Let me thank him for his dedication to continuously communicate with us on the COVID-19 pandemic on the African continent. Let me also thank you, colleagues who have joined us online today, for your similar dedication to continue educating and informing on the COVID-19 pandemic. Lastly, thank you very much to colleagues from the African Union, from the Africa CDC, who are working behind the scenes. Let's meet again next week on Thursday at 12 noon, as usual. Bye-bye for now.
Bye-bye.